So we get this question from a patient, and they said, how many lasers do I need to get after rhinoplasty? So I thought this was an interesting question.
Mhm.
So we actually did a study on this. We looked at our patients. We did one treatment of CO2 laser on them. We were looking at their scars after rhinoplasty. And after one treatment, you know what we found?
What?
It didn't change. So there's other literature that supports that it's not just one treatment with a laser, it's multiple treatments. So I think when you're talking about how many lasers do I need after a rhinoplasty, I tell patients, you know, not everyone needs to have their nose lasered, but if you're looking for it to change, might not see a difference with one treatment, but usually it's like 4 treatments or 5 treatments where you really start to see a difference.
Mhm.
And that's all part of our laser. We include that along the scars for things just because I think it's such an important part of the healing process. But
So it's about, if someone were to ask how many lasers, is it the answer is more as many as it takes, as many as you need?
I think so. I think that part of it. And, you're kind of putting in, and thankfully we have some different lasers because, some patients' nose might have redness along it initially, and then it might be slightly raised, but usually it's really about fine tuning it. And the goal is that the scar is really, really hard to see.
Mhm.
And sometimes they don't want to do a laser. They're like, I can't see my scar. And I'm like, let's just make sure it's even harder to see if they're having difficulty. So